from the minute they were put in, my body started rejecting them.
STACEY Jones is talking about her breast implants that she had put in 16 years ago. Shortly after the surgery, she noticed changes in her mood.
I started becoming sad and depressed and anxious.
But from there, over the years, more changes.
My brain fog was so bad.
Then she started feeling aches and pains and was diagnosed with mixed congenitive tissue disease, an autoimmune disorder. She was medicated for that, but says it didn't help. 3 years ago, her first hospitalization.
Every lab test was normal. Everything was normal.
Her tests were normal, but Jones, a nurse for 26 years, says she continued to feel worse and started her own research and discovered for the first time what's known as breast implant illness, a term some women and doctors use to refer to a wide range of symptoms that can develop after getting implants.
I asked a primary physician, and he said breast implant illness isn't real, and I let it go.
But she couldn't let it go.
I felt this horrible chest tightness, and I'm like, I can't breathe.
Jones says she continued to get worse, wanting answers. She went to a functional medicine doctor.
He took one look at me, and he said, "You're being poisoned."
She paid thousands of dollars to have a plastic surgeon take out her implants.
The minute my implants were removed and I woke up, I was able to take a full breath for the first time in 2 months.
And from there, Jones says her health quickly improved. Weeks after surgery, off all of her medication.
I did not have autoimmune disorder. It's been my breast implants the whole time.
But how common is breast implant illness?
Breast implant illness is a complicated disease process because you can't prove it. So many women present with complaints of general malaise, just not feeling well, joint aches and pains, and a lot of other just kind of somatic complaints that are hard to diagnose.
Dr. Joseph Franklin, a plastic surgeon in Cary, says with symptoms being so vague, it's often a diagnosis of exclusion.
All implants end up with a capsule around them. That's completely normal. What happens, no one's completely sure, but it's thought that the implant plus the capsule is really what's causing the problem.
A problem that Dr. Franklin says is very rare.
The best analogy to use is with every medical device, every medical procedure, everything we do pharmaceutically, there can be a side effect.
Just last week, the FDA now says any woman considering breast implants must be warned of the risks and side effects and ordered manufacturers to include a black box warning. Jones is thankful the FDA took this step, and her main mission now that she feels like herself again is to raise awareness.
I loved my breast implants. I did. I loved them, and if they weren't killing me, I would have loved them for the rest of my life. Not everyone is going to have symptoms of breast implant illness. If you have breast implants and you're feeling great, don't even bother. But if you start having fatigue and brain fog and joint pain, before you get diagnosed with an autoimmune disease and get put on those medications that are toxic to you, if you don't have an autoimmune disease, please do your research.
Research is key. The FDA also points out that breast implants are not lifetime devices. The longer women keep them in, the greater chance they could develop complications. I'm troubleshooter Diane Wilson, ABC 11 Eyewitness News.